A government shutdown is underway in the United States, and the people who may hold the quickest path to ending it aren't in Congress. They're the air traffic controllers who guide every flight in United States airspace. And their experience during the last major shutdown offers a roadmap for what could happen next. The current impasse began on October 1, 2025, when lawmakers failed to pass a funding bill. Many federal operations are now on pause, but essential employees must still report to duty. That includes roughly 10,800 fully certified air traffic controllers and more than 61,000 TSA agents, all working without pay. For travelers, the first few days feel almost normal. Airports stay open, flights take off, but the system is already stretched thin. The United States is short more than 3,600 controllers, its lowest staffing level in decades. Many are already logging mandatory overtime. Now they're doing it for free. To see why that matters, look back to the 35-day shutdown of 2018 to 2019. Controllers and TSA officers stayed on the job without paychecks, and financial stress pushed sick call rates higher each week. Security lines lengthened, delays multiplied, and the aviation network began to buckle. Day 35 was the breaking point. A shortage of controllers in the Northeast triggered a ground stop at New York's LaGuardia Airport. Delays rippled through major hubs nationwide, scrambling the travel plans of thousands and spotlighting the economic damage in real time. Within hours, lawmakers struck a deal to reopen the government. Fast forward to October 2025, and the warning signs are familiar. The National Air Traffic Controllers Association, or NATCA, says the shutdown is already eroding safety and efficiency. Its president, Nick Daniels, points to controllers working long hours while worrying about mortgages and groceries, a recipe for fatigue and distraction in one of the most demanding jobs. This isn't an organized strike. Federal employees are barred from that. It's the practical reality of a workforce under extreme duress. If enough controllers can't afford childcare, can't cover gas, or simply break under stress, staffing gaps widen, flights slow, delays snowball, and the pressure on politicians intensifies. The economic stakes are massive. The United States Travel Association estimates the shutdown is draining about $1 billion from the travel economy each week. Airlines for America warns of mounting slowdowns, while the government itself admits the shutdown is stalling projects meant to modernize air traffic control. Safety layers are thinning beyond the control towers, too. Engineers and technicians who maintain radar, communications, and navigation systems have been furloughed. NATCA says those missing support teams strip away critical backups designed to catch mistakes before they become accidents. For now, planes are still flying, but every unpaid shift chips away at a system that depends on full staffing and full attention. If history repeats itself, the most decisive push to end the shutdown may not come from a hearing room or late-night negotiation. It may come when enough controllers, stretched past their limits, can no longer keep the skies moving, and the nation feels the turbulence on the ground. In other words, the ability of America's air traffic controllers to simply show up could once again determine how and how soon this shutdown ends.
Welcome to AITV News. The federal government shutdown has entered its second day, and a looming healthcare crisis sits at the center of the stalemate. Unless Congress renews Enhanced Affordable Care Act subsidies, premiums are projected to soar an average of 114% when they expire on December 31, 2025. In the next few minutes, we'll unpack how we got here, who stands to lose the most, and what it could mean for household budgets and the broader health system. First, a quick rewind. In 2021, the American Rescue Plan temporarily boosted premium tax credits to help families weather the pandemic. The Inflation Reduction Act later extended those savings through 2025. The result has been dramatic. Enrollment in the ACA marketplace has more than doubled, from roughly 11 million to over 24 million people, and 22 of them now rely on the extra assistance. In Texas alone, 58% of enrollees pay less than $10 a month for coverage. That help disappears in 2026 unless Congress acts. For the average subsidized enrollee, the annual premium would jump from about $888 in 2025 to more than $1,900 the following year. Some examples make the numbers hit home. A 40-year-old in Amarillo, Texas, earning $23,000, could see premiums rise from $0 to $920 a year. A 60-year-old couple in Jacksonville, Florida, with an $85,000 income could face an annual increase of more than $21,000. The stakes explain why the subsidy extension has become the flashpoint in Washington. Democrats insist any funding bill must include a renewal, arguing that failure would trigger a nationwide care crisis. They also want to roll back more than $1 trillion in recent cuts to Medicaid and food assistance, which the Congressional Budget Office warns could leave 10 million additional people uninsured. Republicans counter that the subsidy debate should be handled separately. Some say they'll discuss it later in the year, but oppose tying it to reopening the government. They blame the shutdown on Democratic resistance to temporary funding measures and push back against claims that the policy changes benefit undocumented immigrants. Timing is critical. Open enrollment for 2026 ACA plans begins November 1st of next year, but insurers are already filing proposed rates. In Texas alone, some have requested average increases exceeding 20%, warning consumers of what could come if subsidies lapse. Who gets hit hardest? Low and middle-income families, small business owners, and farmers top the list. The CBO estimates roughly 4 million people would lose coverage outright. Up to 1.7 million of them could be in Texas alone. Hospitals are bracing for a surge in uncompensated care, especially in rural areas. And if healthier customers drop insurance because of higher costs, the risk pool could skew sicker, driving premiums up even further for everyone who remains. As the shutdown grinds on, the future affordability of health insurance for millions hangs in the balance. Whether lawmakers strike a deal or let the subsidies expire will shape not only household finances, but also the stability of the nation's healthcare system. AITV News will keep tracking the story. Stay tuned.
A quiet Wednesday morning in the Bronx was shattered by a single thunderous boom. In seconds, the corner of a 20-story tower at the Mitchell Houses complex peeled away and hurtled to the pavement, captured on cell phone video that spread almost as fast as the dust cloud it left behind. The partial collapse took place at 205 Alexander Avenue in Mott Haven at about 8:10 a.m. on October 1st. A combined ventilation and incinerator shaft that ran the full height of the building tore loose, carving a jagged scar from roof to sidewalk. Tenants remembered their walls shaking like an earthquake and windows rattling as if struck by a bomb. Investigators believe the event began in the boiler room. The working theory, when the heating system was switched on for the season, a gas explosion sent a shockwave up the chimney, blowing the shaft free from its anchors. Moments later, the acrid smell of gas filled the courtyard. First responders were on scene in under 4 minutes. Firefighters, police officers, building inspectors, and Con Edison crews fanned out, using drones, ladder trucks, and K9 units to search the debris. Amazingly, no deaths or serious injuries were reported. Officials credit that outcome to the time of day. Many residents were already at work or school, calling it a major disaster narrowly avoided. The human toll, however, is unmistakable. Roughly 140 people from nearly 40 apartments were evacuated, some fleeing in pajamas, others without essential medication or identification. The American Red Cross set up a relief center at a nearby community center, registering 31 households, 74 adults and 24 children, for emergency meals, clothing, and temporary shelter. One displaced resident summed up the chaos: "You leave with nothing and have no idea when or if you'll come back." Outside the yellow tape, Mayor Adams and Bronx Borough President Vanessa Gibson pledged a full investigation and repairs before anyone is allowed to return. Engineers are now examining every floor, column, and beam to decide whether the remaining structure is stable or if more of the building must be demolished. The collapse has reignited scrutiny of New York City's housing authority. The Mitchell houses, built in 1966, are part of a public housing portfolio that officials say requires more than $80 billion in overdue repairs. Across the city, residents routinely complain of mold, pests, leaking roofs, and failing boilers. Wednesday's incident echoes a similar Bronx collapse in December 2023, another near miss that by luck alone ended without casualties. For the families of 205 Alexander Avenue, luck doesn't replace lost homes. As investigators piece together the chain of events, those families face weeks, possibly months of uncertainty, living in hotel rooms, couch surfing, or waiting in city shelters. And for New York, the falling concrete serves as a blunt warning: deferred maintenance can and will come crashing down. The investigation continues, the repairs are yet to be priced, and a community is left staring up at a ragged skyline, wondering how close it came to tragedy and how to make sure it never happens again.